Probably one of the most statements doctors make when they finish ultrasound at around 16 to 20 weeks is, maybe sooner, maybe later, the placenta is a little bit low, so avoid intercourse, avoid heavy exercise, etc., etc. And then the mother begins to worry. Will I be bleeding? Will I make preterm delivery? Will I be delivering by cesarean section? That's all possibilities when there is a placenta previa. But you should know there is a thing called placental migration. The placenta usually chooses a good place in the womb where there is there are lots of vessels and where there is much blood flow, so to nourish the baby better. Sometimes the placenta is not able to find this place at its first searching, so it attaches a little bit to the near to the lower segment of the uterus, and then later, when the pregnancy grows, when the uterus grows, when the womb grows, the placenta goes with it further up. So, as a rule, a placenta previa should not be diagnosed until about the end of the second trimester, because the placenta maybe still migrating, going up to the fundus of the uterus. But sometimes, when it's total placenta previa, when it's lying totally over the cervical os, this placenta is not able to migrate. But the thing I said before is, when we say it again, the rule is, with exceptions, of course, we should not diagnose placenta previa until about the end of the second trimester. But unfortunately, lots of pregnant women get a diagnosis of placenta previa early in pregnancy, and they start worrying. What I'm saying is, just be patient, follow the instructions your doctor told you. When there's actually a placenta previa, it's still maybe wise to avoid intercourse, but don't make scenarios about cesareans, about preterm deliveries, about heavy bleeding, because most probably the placenta will go up when the uterus grows.